Karibuni sana. This is Saif. We are here celebrating the World AIDS Day, and just to kick us off with a conversation. Karibuni sana, gentlemen and ladies. So just to kick us off, just wanted to know, why do we celebrate World AIDS Day? What really is the significance of, having to celebrate such a day? And what information do we really want to get outside there for the youths and, our generation to be able to understand why this day is so important? Charity.
Okay, thank you. World AIDS Day is a day that is set aside so that we can be able to celebrate with the patients who suffer from the AIDS, which is acquired immunodeficiency. It's a very important day in the calendar because it not only brings the sensitization of AIDS to the population, but also shows support and solidarity with the infected and the affected. And also we are able to create a trajectory to show how we can be able to bring the infections down to zero and to also reduce the impact of the virus.
Wow, I think that is great. So something that, Charity is trying to bring on board is that you are either infected or affected, right? And so maybe, Charity speak about us being able to reduce HIV/AIDS to zero. Is this something possible? Is this something that we can strive towards, reducing the infection to zero?
Thank you. I think it's very possible. There's this target that we had for 2020, the whole world. It's called the 90-90-90 target mission. Yeah. 90% of the people living with HIV should be aware that they have the infection. Okay. And 90% of those who are aware, they should be taking medication.
Yes.
And 90% of those who are taking medication should be having suppression.
Oh, suppression.
Yeah. Like
there's a group that is aware of my status or your status in terms of that. And then we have a group that knows very well they're infected, and so they need to be taking medication. And then there's a suppression group. Yeah. Okay, I think that's good. Almost, I believe there are signs and symptoms about this disease. But, each generation, if I may say it, HIV nowadays don't have a face. Should we still concentrate on the signs and the symptoms of this disease? How can we be able, to train and mentor and make young people be aware of the ABC channels of, prevention?
Thank you so much, Martin. I love how you've made it clear that HIV does not have a face. Yes, there are signs and symptoms of HIV/AIDS, but what's clear, you cannot look at a person and know that this person is infected. Okay, like 30 years ago, the world decided to be marking this particular day, the World AIDS Day, for three main reasons, which is very, very important. The one most major reason is to be able to stay in solidarity with persons who've been living with HIV infections. Also as a remembrance for everybody else who has passed as a result of this particular infection. But moving forward, it's a struggle that all of us, everybody, must come together to make sure that all things possible within our reach can be done to make sure we zero down HIV infections, okay? So focus on signs and symptoms might not be as effective. What is important is us taking care, us being responsible. That's why this theme is basically shared responsibility. Yes, and the world coming together as a solidarity towards ending HIV/AIDS, which I believe it's possible.
Shared responsibilities. Allow me to bring Lucy, even as also we get to hear more from her, and in terms of some of the questions that we can get on board. You speak about shared responsibility. As someone who maybe I assume I don't have someone who is infected in my family. Maybe I don't know anyone. I'm not that passionate about, taking care of the sick and stuff. What then is the role of people who are not in the, health fraternity, or those people who have families that they don't have anyone sick? What role can they play?
Well, that's a very good question, Awila. And basically we see that those who are not directly affected or infected by the virus, so to speak, can actually be the support system. The support system for especially those who are affected and infected. Yes. Because you find that, especially in the world we're currently living in today, that human interaction, that connection with other people, you know, you might be affected by this particular disease, but mentally, you know, your stability is very important. Yeah. Your health generally, it's really about how you take care of yourself. The being able to access and actually take the medications for, in this case, ARVs. And even just leading on to what we are talking about, I would like to direct this to Charity, because I am currently working with a team that's focused on, you know, it's a social enterprise, focused on helping the young people to be able to access the medication for, in this case, PrEP, and even ARVs. Yeah. But you find that there's a lot of stigma that comes along with just being seen at the facility, exactly, going to collect the drugs, and even sometimes the fear that comes along with testing. You know that it's important to test. The results and data has shown that 89% of students in the campus setup or university or tertiary education know about HIV and AIDS. But the percentage that goes ahead to test and know their results is close to about 20%. So where is the gap, and what exactly can be done to bridge that gap, to reduce that stigma and the fear that's associated with getting the medication that's required, and even just getting to know your status?
Stigmatization of AIDS patient. I think first we should establish HIV is an infection. It is the virus that causes the infection, and it leads to AIDS. Now the disease. The disease itself. The disease itself is now the AIDS. You can't have the infection without the disease. And but with time, in the long run, the disease will manifest. Your question was about stigmatization of patients and how we'll be able to access how we'll be able to promote testing of AIDS. I think by now in 2020, the stigmatization has gone very low. It's not as it was in the past years. And this is as a result of the massive campaign against AIDS, so that we can be able to debunk on the myths and the misconception on AIDS. And one of the best key and the key most things that has been used is AIDS is not really a death sentence. Okay. You know, it's a condition in the body. You know, it is a condition that causes your immune system to go down, and not per se a death sentence. So if we encourage our patients, and we have been on the front line trying to encourage them, if you're able to get your immune system up, you can live with AIDS for up to 50 years. And up until now, we've had so many patients coming in to test, but to be able to improve on that, we have self-kits, where the patient can be able to do a self-test, and they've been on promotion for quite some time, and I think the acceptance of the population has been quite good, so that we can be able to get a good number of our population to test their own status. But after you test yourself at home, in the privacy of your home and the comfort of your home, whatever results come in, you're supposed to come and check it in the facility. And I think there have been so many projects enrolled out to our patients. We have that primarily takes care of pregnant mothers, so that they do not have to mingle with the other societies, other members. We have the prevention of mother-to-child transmission. It's called PMTCT. It primarily takes care of expectant ladies who are actually HIV positive. And we've actually seen, ever since we did the segregation, we have a lot of acceptance in this population. Mothers do report to the clinic. It's not as in the past, where, you know, they would have to come in with the other population, and, you know, they would feel the stigma. They would feel stigmatized, so they would actually refrain from coming to the clinic. So we also have the youth clinic that has been purposefully set aside for our youth, so that they can just come and see our youth clinician, and they can have the conversation with them. We also have the VCT centers, and we are enrolling VCTs to the society, so that we can have them stationed not just in the hospital setup. We can have it set up anywhere that the population can easily access it. So these are actually one of the many ways we are trying to at least ensure people test, people are comfortable to come collect their drugs. Okay. And you can actually collect your drug wherever you feel you're comfortable. So if I do feel like I'm going to pick my drugs from Thika level 5, then no one is going to have to force you to do it in Kiambu Hospital. So that is also one way we ensure that our patients access their drugs and they're able to come in for consultation whenever they feel like they do need it.
I think that is so diverse, but we don't really want to believe that what you've mentioned in terms of the youth clinic and it's in every setup, because we know different counties, different areas have kind of different levels of hospital, from level 5, level 4, and stuff like that. But Lucy, before you just continue, I wanted to bring in something, because we are talking about this self kit and stuff at the comfort of your home. Is it really objective? That because the essence of us doing the VCT is to be able, for one, to be able to know their status, and through that there is counseling that comes on board. So if one is going to be encouraged to do a self-test at the comfort of his or her home, are we then reaching the mark? Or to me, I feel like we are losing people, because that means there are very many people who are not accessing counseling. And I mean, Kay, just have the microphone, because I would like you to answer this for us. In your field as a counselor, yeah, do you feel like we are losing more people who are testing themselves in the comfort of their zone, or we should encourage people to test in the public hospitals?
Although for the individual, it's better to test at home where they're comfortable.
Okay.
But I think the pre-counseling is really important, which
Yes.
only happens in hospitals.
Exactly.
So maybe we can hold seminars and counsel people through maybe online, so that they can get the counseling at their homes too.
Yes. Almost. I mean, we are living in an era of technology. I'm really not pro
when Kay,
counseling. And let me just give this example as a sports person. For us to be able to have a good game on Saturday, it means that everyone needs to come in training on Tuesday, Wednesday, and Thursday. Through that, we're able to see what can you do, what special skills have you brought on board. Now, how do we bring that on board on game day on Saturday? It's different from the coach telling me that just train as an individual in the comfort of your home. You can access the gym and stuff like that, and then come play on Saturday. The preparation and what she's really bringing on board, the counseling part of it is key. Okay. And for our context, even as students, we are trying to reach out to universities and the youths and people. Should we really champion for self-test kits, or should we encourage people to go for counseling and be tested?
Thank you so much. That's an important question. It's not just counseling, it's psychology counseling.
Okay.
Psychology counseling is the ability to get into someone's mind.
Yeah.
When Kay was talking about online counseling, I was imagining that electronic counseling where you counseled from your phone and trying to imagine on its effectivity.
Okay.
Psychology basically means that ability to sit down with someone and be able to relate by all possible means on anything related to HIV and AIDS. There's been an uproar about misuse of self-test kits. The donors are complaining that we're giving 1,000 self-test kits, you're giving them to 500 people. Amongst those, nobody's reporting back.
How then can we report back? When I've tested myself as an individual, if I find myself negative, I'll be happy and stuff like that. But we are trying to look at someone who finds himself or herself positive, or even there was some issues with the test kit, because we've heard of some issues happening with these test kits that brings in a different kind of results, and this puts people in jeopardy, and some even end up depressed and suicidal and stuff like that. How can we put our trust on the self-test kits? Because if we give these people and we give our youths an opportunity to go for tests in our hospitals, it's easy, it's effective for them to be counseled, for them to be prepared for the results. Yes, Lucy.
Right. I'm really happy that you asked that question. And I'm just going to reel back into what I previously mentioned about the team that I'm working with that's trying to create an innovative solution around helping young people be comfortable with testing, reporting their results. And just as Mr. Omondi here was talking about, the platform where we can actually do this. Now, whatever kind of solution we're creating, which is called M-Testing, a mobile-based testing solution, which is working together with SAIF, is a platform that, yes, you can get the STKs, the self-testing kits at home, yes, you can opt to actually do the swab and get your results from home. But what this solution is trying to do, that we realized was a gap, is to bring that counselor to you at the comfort of your home, so that you may be able to have a conversation with someone before you get tested and even after you
The
get tested.
conversation is key.
Absolutely. And even in addition to that, I think even Charity would agree that after getting that results, you still need to declare it and send it. If I'm not mistaken, it's to NASCOP, but you will confirm, of course, the organization, so that it can, of course, be ascertained and affirmed, and sometimes even to take a second test, because this is a very, very sensitive topic, and just knowing your status generally is a matter that needs to be taken with sensitivity. So that's some of the gaps that we're trying to bridge with the solution or the platform that we were able to come up together with, to try and help young people use their mobile phones, because right now we're trying to reduce the congestion in hospitals. We are in a COVID-19 pandemic crisis at the moment, and we're trying to reduce that motion and commotion of moving into hospitals and visitor centers. And even as they created self-testing kits, for example, the Chukwa Selfie, what they had in mind is we're moving away from the traditional way of doing things, and we want to make it as comfortable for you, as personalized, as individualized, and that's why they created or designed that product anyway. And so that's why, even as we continue to move forward, we continue to ask ourselves, how might we make the process as seamless as possible, as convenient for you, and even personalized, such that you can have that conversation. It's okay for you to go ahead and collect, for example, your drugs, and even have them delivered at home from the comfort of your home if it's possible. So that's maybe one way that I think is a possible solution, or a plausible solution, that's currently even still in the process of being implemented.
That holds count, but again, we have realized that from the current data and statistics that are coming on board, is that almost 100 young people are being infected daily per se. But the question then is, why is it that the female gender is mostly affected when it comes to HIV and AIDS? Just starting with you, Lucy, as we move ahead.
All right. One of the things that we see is that there's a lot of, when you look at education levels, especially in some parts of the country, you find that education is not generally already a topic whereby everybody has the basic education. It's still in our vision generally, and you will find that efforts are being made to ensure that in the rural areas, in some areas where education has not yet been proliferated, people are still being educated and informed about the risks of having multiple partners, the risks of having unprotected sex, and you'll find that even at the very rural spaces, young people, or the females perhaps, are probably even engaging in sex for other reasons. I'll give you a recent study. In June alone, over 16,000 young women were pregnant. And the reason why they were engaging in sex is so that they could be able to get sanitary pads, right? And so these things are interconnected. You'll find that, yes, they're engaging in it, and the people who are engaging them, they're not using protection, they're not, of course, accessing the maybe the PEP and the PrEP and what have you. And so the lack of information or the lack of knowledge is what is a major fuel still, even to this day and age, in the setups that are not well connected, either with connectivity or with the education. And it's still a question that's still being discussed and trying to be solved.
Actually, you're picking something from the education part of it, and I think you've also related something to do with poverty and a bit of ignorance per se. Almost, why do you think the female gender is mostly affected when it comes to HIV/AIDS cases, positive cases, unlike the other gender, which is the male?
Well, it is true that female gender is mostly affected compared to men. I think there's a difference of about 2%. There are a number of reasons why the female gender is affected, and mostly adolescent girls and young women. These are focus group who attention has been so much given to. One main reason is for their susceptibility is because of their exposure. Okay, they're exposed, at this particular age bracket. Some psychology talks about maturity and sexuality. Okay, how our communities are structured ensures that most of these girls are weak in terms of social care, protection that is being offered to them. Am I making sense to you? Yeah, so a lot of focus needs to be done, needs to be placed on the young girls because they are vulnerable. Making decisions to them becomes too difficult compared to other gender. So it's very easy for women to have multiple sexual partners based on a number of variations within our community. Issues to do with poverty again is affecting girls more than the boys, isn't it? Also the culture, our culture back in especially the rurals, the remote areas, a lot of emphasis is being done on men and not on women. So our girls become much
And
more
you know,
susceptible.
just speaking about culture and tradition, I don't know if it has happened, but you know where I come from, we used to have our stuff like wife inheritance, whereby you wouldn't know if the other husband died because of HIV. And so that really puts them more susceptible, more vulnerable on such cases. Let me just bring in Kay at this moment and ask then, why are women that vulnerable? And what can we do to the female gender? What advices can we give to the female gender for them to be more, you know, informed about their susceptibility and vulnerability?
This is really sensitive question.
Yeah.
Um, okay, for my culture, where polygamy is really allowed, a man can have like 4 wives.
Okay.
So maybe one of the wives is positive,
Positive,
or
yeah.
maybe he is. So he spreads to the rest. So you see, the rest are really vulnerable.
Yeah, yeah.
And I'm still talking about my society.
Polygamy is allowed in your culture?
Yeah, it is. So the HIV awareness is really low, while the stigma is really high.
Wow.
So
The opposite.
yeah.
Okay.
So I think we can decrease that, the women being infected more
Yeah.
by creating awareness
Okay.
about the reality of HIV and AIDS, and also educating them, empowering them about their rights,
Wow.
like the things they have to negotiate for, and to convince them to test their status and that of their partners.
Yeah, sure. I think that becomes key because, you know, they say ignorance is no defense. So when it comes to awareness, sensitization, and, you know, empowering even the female gender on this matter becomes very key. Charity, allow me to bring you in at this moment and really ask then, why are the female gender that vulnerable? Why are they so susceptible? Why do they fall as the bigger percentage when it comes to, you know, even the prevalence and incidence of HIV and AIDS?
Okay. Number one is a woman, in a month's time, a woman goes through so many phases. Okay.
Phases.
Yeah. So
Also, as we go through phases,
biologically
we go through
speaking,
circumcision,
in a
such kind of
month's
that,
time,
okay.
in a month's time,
Okay.
every month,
Yeah, I get
you
you.
have to go through your menses.
Okay.
And for
Yeah,
females.
for females.
And you find that when a woman is in her menses, her immune system is very low at that point.
Oh,
Yes, immune system tends to drop.
Okay,
It's
okay.
not as normal as if you compare it with another female who is
Yeah,
not
sure.
in her menses.
Oh, sure.
So that is already an immunosuppressed state.
Yes.
And infections tend to flourish at this point.
Okay.
So if it happens this lady is engaged into any kind of sexual intercourse or comes into contact with the virus,
Aha.
the chances of infections
Of
are very
infection are
high
very
than
high.
any other person.
Wow.
Another thing is, right now we're speaking of sexual assault, and it is sad to say that in this era that we live in, women tend to be more affected still. Though we
Okay.
have men who have come on board who have been defiled,
Yes.
but because of that sexual assault against the female gender, we also tend to have the high numbers of infections on the female gender.
Wow. Okay.
Another reason is, as I said, immunocompromisation. In a woman's face, not only just the menses itself. You find that the men, physiologically, the men and the woman, a woman has a low immunity than the men.
Yeah.
That is just physiological. And another thing is, when a woman gets pregnant also, we
Yeah.
also have the immune system going down. So there are many phases where the lady is vulnerable, physiologically.
Yeah, that makes sense. That comes
Okay,
in.
so that is why I think we also tend to have these high rates of infection
Oh, sure.
in the female gender.
Well, I think we can never have enough of this conversation, so that is it for today. And just to get your parting shots.
Yeah, like we have said before, World AIDS Day is an important day because we as a living being keep remembering and paying close attention to our loved ones who had passed as a result of HIV and AIDS. And that gives us more assurance, more zeal, more energy of what we can do moving forward, just to make sure that we bring this epidemic below the belt. This year's theme was shared responsibility, kuwajibika. It's a sense of everybody taking charge, ensuring that the global pandemics, including COVID, can be contained. Examples like wearing our masks, keeping social distances, ensures that not just us are safe, but also people who are close to us. So this day is crucial and critical for us moving forward.
Thank you, thank you. Lucy, even as you close for us, they say a healthy nation is a wealthy nation.
Absolutely,
Yeah,
absolutely.
So just close for us with your parting shots and.
Yes, I agree with you. So basically, what I believe in is that the youth is what we thrive with. The youth is the future, and we are a youthful nation. The population of Kenya vastly is between 18 to 35. The majority are young people, and they are the ones that are most vulnerable and susceptible to this particular disease. And so what we are saying is that education should be at the forefront, reducing the stigma and creating a fearless society. And even as this day marks that ability for us to be able to join together in solidarity and to support those who are affected and infected in one way or another, we all are one community, and we all know someone who definitely is being affected by this particular disease. So what we need to do is come together in solidarity to wajibike, as my colleague has actually rightfully mentioned. And every single year, this day being very, very important, we should take that moment to celebrate them and to be able to work together to create that community and society where we have a stigma-free society for HIV and AIDS. And of course, it's been a pleasure having you join us today. My name is Lucy Riley, and this amazing and vibrant youthful team has definitely shed some light on it. Thank you to SAIF, particularly for being able to host this particular day right here at Mount Kenya University. Remember to interact, keep the conversation going on social media platforms at MKU, at SAIF, as well as M-Testing, which is a youthful initiative that's also trying to bridge the gap for the testing for young people.